Hi, I'm Rachna Vyas. I'm the Deputy Chief Executive of NHS Leicester, Leicestershire and Rutland Integrated Care Board.
Hi, I'm Roger Klein. I'm a Research Fellow at Middlesex University, and I do research and work with organisations and groups within the health service around culture, workforce culture in the health service.
Hello, I'm Professor Ivan Brown. I'm a former Director of Public Health. I am currently a Professor of Public Health at De Montfort University in Leicester, and I also sit as a non-executive on our local hospital trust.
Hi, I'm Sandra Goatley, and I'm the Chief People Officer at the Kent and Medway Mental Health NHS Trust.
And hi, I'm Mary-Anne Farrow. I'm the Chief Medical Officer at Health Innovation Kent, Surrey and Sussex, and I'm also a non-exec director at Kent Community Trust and Kent Mental Health Trust.
Welcome to part 3 of our feature podcast series, Standing Firm in Power and Resilience, the final part of our 3-part journey. Well, in series 1, The Power of Our Story, we explored how symbols, identity, and lived experience continue to shape the way people feel and work across our public services. That conversation showed us why understanding the stories behind people's experiences is essential to driving meaningful change. In Series 2, Strength in the Struggle, we stepped into the reality of psychological safety. What it truly feels like for senior leaders to show up, speak up, and stand up while carrying accountability and trying to embed inclusion in cultures with competing priorities. Now, that struggle reminded us that leadership in this space demands courage, clarity, and consistency. Now, in this, our final series, we're taking action and sustaining change by exploring how we move from insight to impact. This is where we consider what meaningful, lasting change should look like, how we embed inclusion into our cultural DNA, and how we build systems that progress the EDI agenda in real and sustainable ways. Well, as before, you know our panel, so let's get started. This is part 3, Taking Action and Sustaining Change. And the guiding question for our final series is this: what would it take to shift culture, especially in making senior leadership more ethnically diverse? And how would those changes be sustained while continuing to drive the wider EDI agenda forward?
From my perspective, Sylvia, I think we still use diversity and inclusion as a separate thing. It's separate training. It's sat over here and it's not embedded into everything we do. So one, I think, and I don't mean training by this, but the development of our leaders and managers in our organisations, this needs to be embedded in every part of that. So we need to understand it rather than, doing some development and then going over here and doing some inclusion development. So for me, it's the embedding, and it has to become part of everyday life. So not something that sits in a different action plan. It needs to be embedded for me.
So I agree with Sandra. I'll give you a couple of examples of how the kind of methodology that research points towards can be applied. So some years ago, you may recall that a nurse called Amin Abdullah committed suicide by setting himself alight. He worked at Imperial Trust. That trust has really tried to change its culture, and a couple of things that they do I think are generally applicable and are now being followed by 1 or 2 other trusts. So on recruitment, when a board for anything above an 8A post makes an appointment, they can't confirm the appointment until the Chief People Officer or the Chief Executive has been satisfied with the process that was followed. That's then followed up on a random basis by, if I imitate the chief executive, by this is what he started ringing up randomly divisional leaders to say, I've been looking at your data, it's not quite where we want it to be. We've got some data. Our HR people are coming down to help you improve it, etc. What happened at first was the divisional leaders were then ringing up all their mates and said, you know what, the chief exec and the chair are checking up on what we're doing when we appoint people. But the real thing was, you didn't want two phone calls, because the first one should lead to change. And it has been bringing about slow but steady change. And the other example, same principle about accountability, scrutiny and support, is not beating people up, is around discipline. The national data, I don't know why NHS England don't talk about this, the national data on discipline, there are half the number of disciplinary cases this year than there were 6 years ago. And the gap between the relative likelihood of white and black staff entering the disciplinary process has almost disappeared, from 1.54 to 1.08. Why? Well, there's a number of reasons, but the most important one has been lots of trusts have introduced a triage system whereby local managers can't send someone into a disciplinary process until they can explain why that's the appropriate response to what's happened. And that's partly influenced by the just culture stuff and so on. So there's lots of examples of things that apply accountability, that imply changing processes rather than just changing people. But we have no system in the health service of properly sharing this sort of experience and learning. And that to me is a big priority in the space of how do we make this sustainable.
So just coming back to something you said in your preamble about in this bit about accountability. So my question all the time actually is, accountable for what? So if I think about my local trusts, we can say actually we've done a lot of work that Roger's described, that Sandra's described, that we've talked about today. How much of it has actually led to an increase in diversity in whatever kind of protected characteristic we look at? Very little actually. So when I look at what they've done, absolutely the accountability is there. The chief execs can all stand up and say, yes, we've done what we needed to. From a performative perspective, hasn't had the blind bit of difference in terms of the impact it's having for the people that we serve. So there is something about that accountability bit. But that brings me on to kind of personal accountability. So I know Sylvia loves this, so I'm going to talk about the pyramid scheme that we've got going on in Leicester. So the accountability for everybody is that we start off with a set number of people that we are going to pull through the ranks in whichever way, from a coaching and mentoring perspective, developing themselves, developing all of the political spectrum that we never really talk about, all the things that somebody helped me with, quite frankly, to help me progress through my career. And we extract a payment, and the payment is that they have to go and help 2 other people. And they could be anybody. It doesn't have to be from a diversity background or anything like that. 2 other people, and they extract payment from them of 2 other people. And slowly we've built up this movement where everybody in the organisation at a band 8A or above has a minimum of 4 or 5 people that they are helping across the track. And that spans organisations, it spans trusts, it spans across health and social care, disciplines. And actually something that small at no cost it's just grown organically. And now actually when I look at the leadership that we've got in kind of 8D and below, I've got one of the most diverse ICBs in the country. And a lot of that I think is attributed to that accountability of actually it's written in your PDR, it's written in the way that we do things, but most importantly, to Roger's point, it's in our culture. That's what we do. And that's just been incredible in terms of just the growth that we've had, just really quickly, organically, and people own it, they believe in it. And it's created a bit of a movement. So there is absolutely stuff that we could do personally to help this, but deliberatively extracting that payment and writing it down has then helped us to spread this far and wide.
Yeah, I love that example, Rachna. And I think that it's that sustainability part, isn't it? It's got to have longevity to it. I guess I've come at it at a different angle. Which is the leaders that I speak to at the moment across the system, it's all about the money. So how can I change the conversation about EDI and in particular health equity to be about the money? So that's what I spend a lot of my time on, is translating it into language where it will cost them money if they don't do anything, and being able to articulate that in a really strong economic way. So we know that there's loads of evidence around, diverse teams are the most innovative. So if we're currently going through a restructure and reform, having the most innovative and creative team should be something that we aspire in our, leadership groups. So that's kind of one thing. Another thing is around, when we talk about not addressing things like racism, what is the cost to the system? What is the cost to the organization? As Roger knows, it's a huge cost. Anti-discrimination claims are costing the NHS millions of pounds a year. The cost of recruitment, retention, all of those costs, the cost of sick leave, when someone's had a racial incident or, currently being investigated, all of these have a financial cost. And so I guess what I try to educate people on is being able to articulate that into a business case so that it doesn't look like, oh no, we've now got to find money for this EDI initiative or for this additional workforce. It's tracked directly into the business planning and into the strategic plan. And we had a conversation yesterday, didn't we, Sandra, about autistic people and their inequalities. And, we heard that autistic people spend 5 years of their life in hospitals. So when you're thinking about the length of stay for this, marginalized group of people, that the likelihood of readmissions, when somebody with autism might be overwhelmed, there might be violence and aggression and that impact on staff. All of these things have a financial cost. And so it shouldn't be about the moral argument of, well, wouldn't it be nice if we could do this? Or, yeah, that sounds like a really good charitable cause. No, it's not a charitable cause. This is the bottom line. If you need to save money, this is where we can demonstrate impact. We know that the highest users of acute care, the 1% account for 30% of the NHS budget. They are often wrapped in the social determinants of health, yet we're just ignoring the problem and hoping it will go away. So that's what I guess that I'm trying to get those that I might not be able to change your heart, but maybe I can change your mind using the money conversation. And I don't really care as long as we get to the same destination. As long as the outcome is there, I'm not bothered how we get there.
It's probably building a bit on Rachna's point and Marianne's point, really, which is this is not a single bullet thing. You're going to have to use everything that's in your arsenal. And one of the things that I think of people who do it well. Okay, so there's somebody that had mentored me, not from my background, but she did it so well. And I started to think of what is it? What is it that Deb brought? And there was an intentionality. So, you might be a chief executive, and you may be a chief executive that has no financial training whatsoever, but I have yet to come across a chief executive who doesn't know about money, who doesn't try to work out, right, I might not be financially trained, but I'll tell you what, I'm going to find out about it. I'm going to know about it. I don't see that same intentionality when it comes to things like race and inequity. Well, why not? That's telling me that it's not as important. So it's not that this stuff isn't out there. You could do it, but are you intentional about doing it?
Yeah.
I knew that when I was in public health, I knew that my role was around inequalities. Now, yes, I come from a working class background, but the nature of things is, you move on, you get up, and as you start to increase job, they start to give you a bit more money. So I realized that actually now I'm removed from the very population that I'm serving. So it was intentional for me to make sure that I hit the streets of the areas that I served, that I spoke to the people in the areas that I served, that I spent time there. we did the thing. Ratchner was there when it was sorted. It was initiated, which was a thing called "Walk in My Shoes," and what you had to do was that you was sent to different parts of the city. You had to shop and get lunch at the place where they got. You had to use the same transport systems. You had to go to the school. You had to immerse yourself in that community. Now come back and talk to me about, oh no, we can't quite afford to spend that in that community. So I think there's a bit about, for leaders, the importance around being intentional about addressing this problem, just as you would be having a conversation with your chief financial officer. Chief execs know how to have a conversation with their chief financial officer. Sandra may have a conversation with me, but often they don't know as well how to have as good a conversation with their chief people officer.
In this last series, we've been focusing on taking action and sustaining change, looking at what it takes to move from insight to impact in a real and practical way. We highlighted the importance of personal accountability through mentoring, supporting others, and making sure EDI values are built into everyday work, not treated as something separate. We talked about the real cost of poor culture and why the EDI business case needs to go beyond moral arguments. You know, when 1% of marginalised acute care accounts for 30% of NHS spending, it's clear that inequality has a major impact on people, services and resources. And then for leaders, being intentional matters. Addressing inequality doesn't happen by accident. It happens because someone chooses to act. And this is how we continue to take action and sustain real change. So as we close out this series, here's a simple reflection. We don't need to do everything, but we are responsible for what sits within our own influence. To run our lap, as I often say, to do our part well, and to pass on something of value to the next generation. Well, I want to give a really big thank you to our panel for their time, expertise, honesty and commitment to keeping the focus on this important agenda. To Ratchner Vyas, Roger Klein, Professor Ivan Brown, Sandra Goatley and Dr. Mary-Ann Farrow, thank you. Well, I hope you enjoyed listening to this series, and if you haven't had the chance to listen to all 3 parts, you can catch up anytime on the Absolute Diversity LinkedIn page and also on our website. Until next time, let's keep focused on these important topics by standing together in power and resilience, because this is how we continue to change culture.